Good afternoon, and thank you for joining us today on our WREA conversation. We're going to be talking about Medicare and the WREA trust and the MedPlus plan because we've had a ton of questions about that. So I appreciate you joining us on this special time. My name is John Green with Association Member Benefits Advisors, or AMBA. I'm joined by my co-host, MJ Woodall. I'll let her introduce herself in a little bit. Also by Diane Wolchinski and Annalise Rhines. Talking from the WREA perspective, before we do jump into our conversation, I want to do a couple of housekeeping details. For those of you who have never joined us on these calls before, these WREA sponsored webinars, we do record every webinar. We post it out on the WREA website so that you can follow up and look at it and, maybe take some notes on things you didn't know before, share it with a spouse, with family members. Just a good opportunity to review some of the things we talk about. But all participants are in a listen-only mode. And what that means is we're not like the regular Brady Bunch Zoom. It'll just be the few of us on the bottom on your screen here. But if you've got a question or you want to make a comment, please use that chat feature or the Q&A feature. We'll monitor that chat and Q&A. And if it's something that's specific to you, we'll respond back specifically to you. If it's something that the whole group would benefit from, we'll answer that question as well. But we do, like I said, we record these, we put them out on the WREA website. You'll also notice this QR code. I'm going to ask you to have your smartphone handy. It operates just like the QR codes in the restaurants that we go to these days to get the menus. You'll have an opportunity at the end of the conversation, if you want to have any questions specifically answered to you, ask more about our topic, ask more about WREA, AMBA, whatever it is, then you can use that QR code. So thank you for joining us. Let's go ahead and jump on in here. I want to do a couple of things just to kind of set the stage. And then we'll jump off into our conversation because this is a topic that's pretty hot right now. That's why we're doing multiple webinars like this. We'll make sure that we've got that answered for you. But before we jump into the topic at hand, we have a big event coming up next week. Diane, finally, tell me all about it. Tell me what's going on up there in Wisconsin besides the rain right now.
Right. Well, thank you, John, and welcome everybody. Yes, as John said, next week is our annual convention. We're going to be at the Ingleside Hotel in Pewaukee, and it is September 26th through the 28th. And we have a lot of different speakers. John is going to be there to do a couple of sessions. We're going to be doing a lot on the voting and the power of the 50 plus voter. We have some fun things that you can do, a lot of learning, a lot of getting back together. And this is our first convention now in a couple of years that we're going to be back in person. So we're really looking forward to it. And if you are interested in attending, you can go to our website, www.wrea.net. And right on the homepage, you'll see how to register and maybe come and join us there. There are other events on our website under the events tab at the top, and you can see all of the webinars that we're going to be doing and other meetings also, and training sessions, etc., that you might want to participate in. So hopefully some of you might be able to join us either next week or sometime in the future. So John, back to you.
Thank you very much, Diane. I want to have you come back on here in just a moment, but do a couple introductions as well. My name is John Green. I work with AMBA. I live a little bit north of Houston, down in Texas, where we're having our second summer. It's 99 degrees tomorrow. So looking forward to getting up there with some cooler weather with all of you. But I've spent the better part of my 30-year career in schools helping active educators understand what their retirement years are like. My wife is a second grade elementary school teacher in the same school that she grew up in and my kids all went to, but I really appreciate the opportunity to share with you some of my experience and talk through some of these difficult conversations, especially with the one that we're having today, because it does cause a little bit of concern on behalf of some of you who are on this call today. But more importantly, we want to set your mind at ease that WREA has some answers for you. And my co-host today is MJ Woodall. She is our district manager, our leader up there in Wisconsin. So good afternoon to MJ. Why don't you introduce yourself and tell us about your furry family and your regular family?
Awesome. So good afternoon, John and Annalise and Diane and everyone that is joining us today. Excited to be back to help answer any additional questions that everyone has, or if you're new to this, to be able to answer those first questions. So this is a picture of my family, and I'll start with the furry little guy. I'm not going to say his name because usually if I say his name, he'll come running in like a crazy little guy. But the picture on the bottom left-hand side is when we picked him up 2 years ago in August, when he was 8 weeks old. And then the picture on the right-hand side on the bottom is exactly 2 years later. So that was his got you day, birthday, if you want to call it that. But that little guy's name, actually, I'll say it really quickly. It's Bucky. And I say it quietly just in case, because I know where he is in the other room. But he has been a lot of fun for us. And actually, I'm sure for those of you that have animals, cats, dogs, birds, fish, what have you, that probably is the same for you as well. And then the picture above is a picture of my family. And I get the privilege and luxury to be able to work alongside of 2 of my family members, along with the rest of my team. And so my 2 boys decided to join in on basically helping all of you, just like the rest of my team does, helping all of you understand what discounts are available to you through the benefits that we have, as well as the different benefit programs and where there's gaps in coverages. And the biggest thing that I can say is that your biggest benefit that you have is the phenomenal pension that you have being an educator in the state of Wisconsin. And it is like no other pension program that is out there. And basically that is such a huge, huge benefit. And your membership in your association is just a small fraction of amount that you pay to be able to protect that largest benefit that you own and that you have, which is your pension. And so I'm going to turn it back to John. He'll go into that a little bit more, and then we'll get on with the program.
Thank you, MJ. Appreciate that. Again, MJ is the co-host today. She'll be monitoring the chat. I'm going to have her share here in a little bit some of the experiences she's had on this particular topic. But I can tell you, you are blessed in Wisconsin to have MJ and her team up there to help you navigate through this process, because it is a little bit different. And for those of you who maybe have joined us that are not familiar with WREA, whether you're a member or whether you're not a member, but you're here just because of the topic at hand, as MJ mentioned, your pension is the biggest benefit of you having worked all the years that you did in education. And WREA is there to be a pension watchdog. Diane brags about the Wisconsin pension all the time. It is a phenomenal pension, one of the best in the country for educators. It's because of the efforts of WREA to support that and to preserve those health benefits, keep you connected, like next week when we're all together at the convention, and then partnering up with folks like us at AMBA to offer discounts, benefits, ways to stretch that pension dollar more, especially in this time of inflation, and to make your retirement years much more peace of mind. So we're going to roll through some things like talking about the WEA trust issue. But for those of you who aren't as familiar with AMBA, we are an organization that partners with WREA and other associations very similar to WREA across the country to provide membership services, benefits, discounts, all sorts of things, again, that you may have left when you left the schoolhouse that you don't have coverage for anymore. They're portable if you decide to snowbird down in Texas, Arizona, Florida when the winter hits up there. But you can also extend these benefits to your family members, whether your parents are still living, maybe adult children who have aged out of your benefits, something like that. And because we find that oftentimes teachers, when they leave the classroom, they don't just stop working. They may take on a second job, do a lot of volunteering, something like that. With the proper planning and proper benefits on your parents even, or a loved one, it prevents you from having to take extended time off to take care of them as well. But today our topic at hand is this whole WEA trust MedPlus situation. So we're going to talk a little bit about the difference between WEA and WREA. I'm going to have Diane share what that is, talk about the situation, what options that you have, kind of the process that you've got to take between now and the end of the year. And then we're going to touch a little bit on Medicare, just as kind of a refresher, because there are some things that Medicare does periodically that changes your coverage, that makes it more difficult, more costly, some things that aren't there, and kind of help you understand this whole Medicare concept, especially for those of you that have been on the WEA Trust MedPlus program for many, many years. You've been kind of riding along, and all of a sudden you're making a change. You need to know what's out there and what's out there available to you. But what I want to do right now is kind of get a sense of who is on our call today and find out how many of you currently have your Medicare plan through the WEA Trust. So if you'll just answer this poll for us there, yes, no, or you're not sure. Drop that in there. That will help MJ and I and Diane kind of craft how we share our conversation today. We'll open this up for about another 10, 15 seconds. Make sure we get at least 75% of you a chance to participate in this poll. All right, last call, 3, 2, 1. Okay. So overwhelmingly, we're about 90-10 that have their plan through the WEA trust. So that's good. You're in the right place, because this is exactly what we're going to talk about today and go through this conversation so that you know what you have to do, when you have to do it, and then what your options are going forward. So we'll go ahead and jump on in here. And before we jump into the issue at hand, I'd like Diane to come on and talk just a little bit about the differences between WREA and WEA and the WEA trust. So Diane, kind of clarify, because oftentimes you say you get calls from people asking about one or the other and not sure which is which.
Okay, well, first of all, WEA Trust is really an arm of WEAC, WEAC. And so the trust is, the WEAC represents active educators, so the people who are still working. And WREA, we were formed in 1951, and we represent primarily retired educators. Although we are open to everybody, we certainly have the primary audience is those that are retired. Our signature goal is to safeguard the Wisconsin retirement system, which everybody, if you're in a public school setting, participates in. WEAC does not have that in their mission. We have that in our mission, very clearly stated. They do not. We support public education. Obviously, WEAC does also through their work. WEAC also is a union. It's a teachers union. So they endorse candidates. We are nonpartisan. We do not endorse candidates. We are political because we support the interests of retirees, but we will not come out one way or the other for when, like for governor or senator, representative, anybody. We do not do that. We offer through AMBA and through other member benefit partners a lot of benefits for people that once they belong to WREA, they can then, if as they need, they can participate in those at usually reduced costs because of being a member of us. The trust really has a lot of different insurance plans. As you know, they have the health plan that they're ending. They have long-term care, other benefits that they offer. Most of their benefit offerings actually flow through NEA, which is the parent group of WEA. So a lot of those, that's how they funnel through with that. So there's a big difference between the two of us. And like John said, people often get mixed up. And when they think they're talking to WEA, they're really talking to us. And so we have to kind of, figure that out. But we're getting better and we're getting our word out there. So our name out there. So people are getting a clear idea of who we are and who WEA is.
Great. Thank you, Diane. I appreciate that for providing that clarity for us here. So this is the situation at hand. This is why we're having this conversation. Back in the summer, you probably got an email. You may have seen it in newspapers, you may have gotten letters, whatever it was, that the WEA trust is exiting the health insurance market, which means that they are getting out of not only the health insurance for active employees, they're getting out of their MedPlus, their retiree plan as well. They're stopping that at the end of this year. So you can put that down. They're exiting that market at the end of this year for health insurance. They are keeping and will continue to offer their long-term care, their life, and their vision coverage. So if you have one of those plans through WEA Trust, this does not impact that. Let me put a little asterisk on the vision piece, because sometimes your vision may be wrapped up in your WEA MedPlus plan. And so we're going to talk a little bit about that. But so this, everyone should have received this. And everyone should have received this particular letter. So you will receive this letter back in the summer, late June, early July, that effective December 31st, the WEA Trust MedPlus plan will no longer be eligible, will no longer be available, and that you have to find coverage somewhere else. If you have your prescription drug plan through WEA's MedPlus program, you still also have to find that somewhere else. Okay, so that impacts your prescription drug plan as well. Some people don't have that, but it does cut off December 31st. WEA, the MedPlus program, is encouraging you to make your changes before the 7th of December. And again, as I mentioned, it doesn't impact your vision, long-term care, or life plans if you have those separate from the MedPlus program. So just to recap, everyone who got this letter, even if you can't remember if you got this letter, but you were having a deduction for MedPlus plan, you will no longer have coverage effective December 31st. Okay, not to worry about it. We have options for you. We're going to show you that. There's options out there for everyone. So what this is, MedPlus is a Medicare indemnity plan. So think of it as a supplement. Think of it as a plan that uses the Medicare program as their basis, and then you have your Medicare coverage that way through them. It's offered as a package plan, which would include your Medicare indemnity coverage, your vision coverage, and your silver sneakers coverage. There are cost components to all of them built up into one, or you can have these individually. So if you have a vision plan and it is individual, it is outside of the MedPlus plan, that's the piece that's not going away. But if you have your MedPlus package with indemnity plan, the vision coverage, and the silver sneakers program, that goes away in that regards. So you've got to make a decision going forward on what you want to do. A lot of people don't realize you're paying for the silver sneakers program right now, as if you're a MedPlus member. So it's part of that, is part of your plan in there. So that's what the components are. A little bit deeper is that you had no type of age or gender penalties. Rates were still based on your location. You have deductible coverage, copay coverage. Again, what it's doing is operating very similar to a Medicare supplement plan that takes the Medicare components and then covers up any deductibles, copays, out-of-pocket expenses with this WEA MedPlus plan on top of that. So again, and it doesn't have any network limitations. So it's not a Medicare Advantage plan where you're tied in and locked into one particular program in that regard. So that's what the WEA MedPlus plan is covered for many, many years. But again, that's going away on December 31st of this year. So what you're going to have to make a decision, you're going to have to make a decision on what is my replacement Medicare plan and how will I qualify. Now, I don't want you to scare you about qualification because there are a wide variety of Medicare supplement plans. Some of them have qualifications and health screenings that are a little bit different. MJ has gone to bat for you, and she's going to share here in a moment a really, really neat situation that WREA members have available to them because of what she did. If you have the vision plan that's bundled up in the MedPlus program, you've got to figure, where will I get my coverage for that? And then silver sneakers, do I want to pay for this coverage? Did I even know I was paying for that coverage? What do I want to do if I have that out there? So I'm going to encourage you right now to do this. If you'll take your smartphone, open up your camera feature on your smartphone and hover over that QR code. A little form's going to pop up, hit your finger there, and then you can select Medicare Solutions, fill out that information, and we'll get back to you as quickly as possible. We'll have this QR code later on. I just wanted you to get your phone out because this is how you're going to get the primary point of contact to find out how your MedPlus transition can work to the alternatives that we have available for you through WREA. All right, so here's what you have to do. You've got 3 steps that you have to do. You need to get this letter over here. Now, MJ, you can help them find this letter. Is that correct? Or you have copies of this letter?
Yes, I actually have copies and my team members do as well. So if you are making a change and wanting to move forward, we can actually help and fill out that paperwork for you. We can't submit it for you. It has to come from you because there is a signature piece, but it is something that we can actually help you with by helping you complete this. So you don't have to worry about going out to another website to get something else.
Great, because we've had some people that have been on this plan saying, I can't find this letter. I don't know how to get this letter. I'm a little apprehensive. MJ and her team have a copy of this plan notification. You have to get that letter, complete it, sign it, and send it back on you and your spouse if it's applicable for a spouse. You send that back. That makes sure that you are clean and clear off of that plan. That covers their tail is really what it does at WEA Trust. It covers them to make sure that they have properly closed the shop, so to speak, and closed the door, swept up the floor, and they're out of the business altogether that way. You contact us, contact MJ through that QR code, email. I'll show you that in a moment. And then you've got to decide what type of plan and when you want it to start. I don't encourage you to wait until December to do this because there is such a rush. You get lost in the holidays, things like that. You can start this process now and make it effective the 1st of October. You can start it and make it effective 1st of November, 1st of December. Don't wait. Please, please, please don't wait until the end of the year to do this, because there will be so many people involved in this. Make sure you've got peace of mind in this process. So 3 actions. Find that letter, but if you can't find that letter, you can contact us. We have copies of that letter that you need to provide back to WEA Trust. And then you just need to pick a plan, pick a start date. And the good news is there's some opportunities out there for you. The good news, yes, ma'am.
I'm sorry, can we go back one page, please?
Absolutely.
I just want to clarify. So before you fill this form out, which is the form that John has up on the screen, before either you fill it out or we fill it out and get it to you, this form is basically what is going to end your coverage earlier than January 1st, if that's the route that you want to go. So if you are wanting to start on, I keep forgetting that we're in September because the year just keeps going by so fast. But if you're wanting to start October 1st, November 1st, December 1st, that's when this form gets filled out. And I recommend holding off on doing this form until either we work with you on a plan or whatever else you end up doing with somebody else, because you have to be able to say on this particular piece, you'll notice there's a spot that says request a date of termination. That is if you are going to terminate your benefit with WEA MedPlus plan prior to January 1st of 2023, that's when this form needs to be filled out. And the reason why some people are doing that is because of some of the things that you'll see on future slides, because there is a difference as far as not the benefit's the same, but there is a difference, and we'll walk through that. But I just want to make sure that nobody's filling this out before you've got something else in place, because this form says, I'm going to stop. So we've got individuals that have been changing over their coverage. The earliest ones have been July 1. And so that form was something that they were completing at that point so that it ended their coverage with WEA MedPlus because their other coverage was starting on July 1, as an example. So sorry about that.
Well, that's perfect. Perfect. Again, that's why we have MJ on here. Keep us on track and answer any questions you've got. If you've got questions, put them into chat, put them into Q&A. At the end of the conversation, we'll stop the recording. You can hold up your hand on reaction, and we can unmute you as well. The good news is that MJ and WREA have gone out and found a replacement opportunity through Cigna, which is a company that's been around since the Revolutionary War, since the founding of America. Full Medicare supplement plan, just like you had with the MedPlus plan. It's the same medical coverage you had previously. You have some options to add the vision and the healthy rewards if you want to. The great thing about this, no matter your age, no matter your health conditions, you have guaranteed insurability. You may not have that with any other plans, but you have it with this plan, and it starts the 1st of the following month. So before we talk about some inflation busting, some savings and all that, MJ, you want to fill in some color on the Cigna plan and who Cigna is as well?
Absolutely. So Cigna happens to be an A+ rated carrier of ours. We've been utilizing The benefits with Cigna, they've been around, as John said, for a really long time. They are endorsed by WREA as well as 73 other associations nationwide. So when AMBA's going out and getting benefits, we only will work with those A+ rated carriers, but they also have to be endorsed by your association. So the good news is, in order for us to even be talking about any benefits at all, that is something that has been vetted out by AMBA. It has also been vetted out by WREA. Okay. So Cigna's been around for a really long time. The benefits that you have available to you through Cigna, through this plan, are no different for the medical coverages than what you have with WEA+. So if you are in what's called or commonly known as Plan F, as in Frank, which has the base plan in the state of Wisconsin, a base plan and 5 riders, that's the exact same benefit that you will get when you move to Cigna. And the other thing I'll throw out there, well, let me finish this piece. I'm sorry. If you are in Plan G, so if you were turning 65 January 1st of 2020 or later, you're no longer eligible for Plan F. You're only eligible for Plan G. That would be the plan you have with WEA Trust MedPlus. That would be the same type of plan that you would get. If you want to add in vision, we have an option to do that through our provider that is also endorsed through WREA. The benefits have been phenomenal. Individuals have loved that. I can work with you on that. And then if there is a desire to add on a program similar to Silver Sneakers, they just call it something different there. There is an option to do that as well. The thing that I think a lot of times people get confused is they think that WEA Trust is a Cadillac plan, which it definitely is, and that there's nothing else out there that's like it. It is a Cadillac plan. Well, here's the cool thing. Cigna is a Cadillac plan. Every Medicare supplement plan that you have is a Cadillac plan because they have to offer the same exact benefits. The only thing that can be different is the price point. So I say that one more time. The only thing that can be different is a price point. So that I just want to make sure I've shared that. And of course, I had something else I was going to share and I've lost that, but I see we've got a couple of questions. So let's maybe break to those. Is that
question.
Good?
Absolutely. We talked about how long Cigna has been around in America. How long has Cigna been in Wisconsin, and have they offered Medicare supplements for a long period of time?
So I would have to do the research to find out how long they have offered the plan in Wisconsin. What I can share with you is that I have been with the company 6.5 going on 7 years, and Cigna has been here well before I came on board in Wisconsin. So I'd have to do that. They're not going anywhere. Again, A+ rated carrier. I do recall what I was going to say. Cigna, if you go out to Cigna and try to get the benefit with this particular plan, you're not going to be able to get it as guarantee issue. John had talked about the fact that I had, I think you used the words gone to bat. I literally contacted our contact at Cigna, shared with them what was going on with WEA Plus, and asked them if this is something that we could do as a guarantee issue. And that is exactly 100% what we were able to do. But that is only something that is available when you work with AMBA on a Cigna plan. So if you try to go get a Cigna plan yourself, this is not going to be guarantee issue. They made that special exception for WREA members when you're working with AMBA. Now I'm going to skip down a little bit because WPS and AARP are guarantee issue. They absolutely are. There's a couple of other companies that are guarantee issue. What I can share with you is from the conversations I've had with everybody, the rates with Cigna for the exact same benefit that WPS is offering, AARP is offering, and the other companies are out there offering, the Cigna plan has got the best price point, especially when you've got somebody else living in the home with you and potentially also on the plan. This is not a new plan. This is a plan. Cigna has been around. Medicare supplement plans have been around for a long time. The only thing that is different about this plan is this plan has been It's got a rating that literally, as far as the price points, are rated at a much better rate than what their previous plans were rated. And so this is an excellent plan. Do they cover physicals and full and routine eye exams? So your eye exam for routine eye exams are going to be something that you would go with a vision plan. Okay. If you're going to have something that's going to happen medically to your eye, let's say you're cutting the grass and you get a tree branch in your eye, something to that effect, that would be considered medical. So then if Medicare covers it, your supplement's going to cover it. The other thing that I can share with you is there is a book, and I will get the link and I will put it in the chat. Every single one of you that's on this call that has Medicare probably has this book on your coffee table someplace or on a shelf. And okay, so I don't know who is out there saying that this Cigna is not the same. It is the same. So if you'd like to identify yourself or send me a private message, we can absolutely do that. So I'm not sure who's giving that wrong information out there, but I will tell you, Cigna is the same benefit. They offer the same benefits that John had on that other screen. They don't have vision added into it. That's not part of it. They don't have the silver sneakers added into it. That is not added, that is not something that is added in. It is something that you can add in if you want to, but even those price points have been lower than a WEA trust or WPS. Okay, so I will share that with you. The guide that I wanted to share is the Medicare and You guide. Every year you get a guide that's called Medicare and You. This year it would be Medicare and You 2022. Next year, Medicare and You 2023. So I will share with you that is a link that I can give you that will be, I can get that actually dropped into the actual chat so that you see that. As far as what's covered and what's not covered, the best thing for you to do is to go out to that guide and look on the very beginning pages of the guide, which is pages like 2 through 6, I believe it is. And on that guide, it will have a list of all different services. Look up the service that you're interested in. To the right of that, there will be a page number. And that page number will tell you where to go and you can see what's covered, what's not covered. Okay. Let's see here. I think that is it for what I can see right now.
Okay, thank you, MJ. We're going to come back and talk about a few things in regards to that. The biggest thing to point out with Medicare supplement plans, what the government allows to be paid and coverage is the same across all different supplement plans. Sometimes other companies will build up a few things. So let's talk about financial issues. Let's talk about the money in this situation. So MJ has worked with probably going on 100 different couples right now that she's working with, WREA members that are having to make this change. And so with the guaranteed issue, that means they didn't have to worry about any health concerns. The rating is simpler in that regards, but the savings have been pretty big. So MJ, you want to share with some of the examples that we've seen here so far that you've got?
Absolutely. So these are just a couple of examples. This is not all inclusive, and it's going to look different for every person because Medicare is based off of the zip code that you live in and your age and whether you're male or female. Okay, that is a little bit different than what WEA Trust did. They kind of grouped people together within certain things. So here's an example of somebody that's a single individual, not living with anybody in the home. Their rate with WEA Trust is $263. Their rate with us, $209. So that's a savings of $54 a month. And that is not with any additional discounts that were added on because there isn't the ability to have any additional discounts, not have anyone living with you or also on the plan with you. The couples situation, and this is again, just an example, every situation is going to be a little different, but the couple situation that's listed here, they were paying $468 as a couple. So for those of you that have these plans and as a couple, you know that it's a couple rate that you have, right? So if you break that down, it broke to about approximately $234 each. Well, when we did the benefit for, I'm going to use Mrs. Jones as the name. That wasn't the name, but I'm just going to use it. But when we did the benefit for Mrs. Jones, hers rated out to be 133, Mr. Jones at 175. So that came to 308 as a total. Okay. And then obviously you can see that that's a savings of $160. We've been seeing a lot of them saving at about $120 a month. We've been seeing quite a few of them at that. But again, that is going to be something that is going to be based off of your zip code, your age, and then of course, whether you're male or female.
And then you're seeing the discounts for adult children in the household. I mean, there's other things than just for spouses that even can reduce the rate even more. How does that work?
Right. So let's take this single individual that's on the left-hand side of the screen. If they would have had somebody living in the home that was 18 years of age, not necessarily obviously on Medicare, or maybe not even on the same Medicare program, but just an adult living in the home, that would have provided an additional savings of approximately 6% off of that 209 rate. So you can see there was still a great savings, but it would have come down even more if there was somebody else living with them. When there is a spouse or a significant other that's in the home that has got the plan as well, there's a greater savings because they get not just the living with someone, but they get also the household discount.
Okay, super. So
And
go ahead.
real quickly, this also, we don't find a lot of people that are out there that are necessarily smokers any longer, but every once in a while we'll have somebody say that they are. Traditionally, that is something that can make the difference in a Medicare supplement plan. It can be higher. This is not something that impacts in this case because it is considered guarantee issue with Cigna through what we're doing here. So just wanted to let you know about that. And then the other question that often comes up is, okay, I want to make this change. Now, what do I do? So the letter that John first showed that was announcing the change that's going on, that was going to be happening, we have what I'd call a generic copy of that letter. So we don't need that letter any longer. WEA Trust has worked with us to give us a copy of that letter so that we have it for all of you members. Okay. So long story short, the only thing that we would need is each of you has a WEA Trust card that has your group number on it and both of your names, or your name if you're single. That card would be something that we would need to upload in our system to offer the guarantee issue.
Super. Okay. And we'll talk more about what that process looks like in terms of getting a hold of you and how we can get that process started for them. So let's kind of dive in real briefly about Medicare. I want to hit some highlights of Medicare, how it works for you, and is that really all you need in retirement? And this is just a good refresher. Everybody on here is on Medicare on the call today. So we're going to kind of run through this rather quickly. You've got to decide how you get your coverage. Everybody gets Part A and Part B. You get it through SSA.gov, and it's, you know, you're billed for it and all that kind of stuff. Then you've got to decide, do I go the Medicare supplement route, which is what the WEA MedPlus plan was, or Cigna, that route, or you've got your Medicare Advantage plan options that way as well. So you've got to make some decisions with how you receive your Medicare there, but just a real high level overview, just as a reinforcement, so to speak. Part A coverage is your hospitalization. This is your, when you go to a hospital, when you have your treatments, when you have your surgeries, your accidents, things like that. It's also for that nursing home care, that short-term skilled care to help you get back on your feet. I want to clarify that here in just a moment. Some end-of-life hospice care in there, semi-private rooms, general nursing, drugs as part of your inpatient program, not your ongoing prescription programs, things like that. This is not, Part A is not your doctor visits, not your long-term nursing home care, and it's not anything that's personal care, like private rooms or telephones or phones in your room, comfort items, things of that nature, and anything beyond your lifetime reserve days. So Part A, you've had that taken out of your paycheck all your life. You just have that if you're over 65 and you've enrolled in Medicare. So that's something that Part A is. Then Part B is your doctor services. This is your physician visits, your outpatient care, any type of home health, durable medical equipment, and preventative services, you know, such as your checkups, your mammograms, things like that, any type of preventative services. Part B does not cover your prescription meds. That's what Part D coverage. So we've got more alphabet soup. Any type of skilled nursing, and that would be like a long-term care situation or any type of true skilled nursing, hearing, dental, and vision, hospice services, or hospitalization. That's part of that's covered by A, part of it's covered outside. So you got Part A, which is your hospital, B is your physician and preventative services and how that works. Then you come in, and as MJ talked about, you have your supplement options. So you see this alphabet soup laid out across the top. And depending upon your age, you could have gotten a Plan F, now maybe just a Plan G, but that's what the WEA Med Trust or MedPlus program was to the WEA Trust. Cigna Plan as well. You get this Plan G that comes in and covers all of your co-insurance costs, your hospital costs that are not paid for by Part A of Medicare. It trues those up and gives you 100%. Your Part B, your doctor visits, those type of things, that trues them up 100%. There is a deductible in Part A, that's taken care of. Any type of skilled nursing co-insurance taken care of with your supplement. Your Part B deductible, $233, is the only thing that's not covered by a Plan G supplement. But for most on this call, I would presume, MJ, everybody's eligible for a Plan F. Is that correct? If they're over 66, 67, something like that?
They're eligible for that if they had the Plan F previously. And so basically anybody that turns 65 January 1st of 2020 would be only eligible for Plan G. Anybody that turns 65 prior to that time is eligible for Plan F or G.
Great. Okay, super. So again, those of you older than 65 2 years ago, Plan F is what you have. All Medicare supplement plans are the same, no matter who provides them. So that's important to point out. We've had a couple of questions about that. They're all the same in that regards. Okay, now let's talk about Medicare in reverse. And I want to show you kind of how this works in real life so that you're aware of how Medicare is. And again, I'm not trying to scare you. That's not the point of this at all. I just want, as part of our WREA responsibilities, that you're educated on Medicare and how it works. Over the past decade, didn't matter what party was in power, so to speak, who was in the administration or in Congress, they've been making these sizable cuts off of Medicare, mostly to hospitalization services and reimbursement rates to providers. And that's why you see so much change in doctors saying they accept Medicare or Medicare Advantage plans, people being in network, out of network, all that kind of stuff like that. It's resulted in getting close to $1 trillion in cuts. And this can really work its way out to you in a variety of different ways. Let me kind of share how this could work to you. What Medicare will do is they will take, and every year there is a laundry list of procedures that is simply a medical code, a billing code that says right knee replacement is billing code XYZ. Well, 1 year, that billing code could mean that Medicare reimburses for any care after the hospitalization. But they make a change, and the next year, the same procedure, the same care, everything that you're going to get in the hospital no longer qualifies to have any after care, any care after you leave the hospital. Simply by the stroke of a pen, they move something that is considered an inpatient procedure that you receive benefits for after the fact, skilled nursing, to an outpatient procedure, which doesn't qualify for certain benefits. And so it can be something that you may have had coverage before on your left knee, and now you don't have coverage on your right knee. But every year they keep adding more and more surgeries, more and more procedures, and that can really kind of put you at a lurch. And I want to show you how Medicare supplements do and do not work in this. And it's because of this observation status. So think about this. A surgery or procedure is quantified or in the Medicare arena as an inpatient procedure or an outpatient procedure. It doesn't change how the procedure is performed in the hospital, and it doesn't even change how many nights you spend in the hospital. What it does do, it changes how your care is taken care of after that hospital stay. If you're in an observation status and you're even spending the night in the hospital to have your procedures done, you are not admitted as an inpatient. When you are not an inpatient, you don't receive certain benefits and coverage after the fact. You're considered an outpatient. And this is kind of how hospitals set this up. And the reason they do this is because Medicare provides funding to hospitals based on their success rate of inpatient surgeries. They're trying to reduce the number of readmittances back to the hospital. And so the way that Medicare gets around this, and the hospitals satisfy this, is that they will have you as an outpatient, and therefore there's no chance of worry about losing any Medicare funding in the future. And so what they'll do is you have the ability, when you go into a hospital for any type of replacement surgery, accident, something like that, if you are admitted as an inpatient because the procedure requires an inpatient classification, you have some skilled nursing care. And Medicare will pay for your skilled nursing care after a 3-day hospital stay. So write that number 3 down. After that 3-day hospital stay, if you're an inpatient, you then have skilled nursing care covered for 20 days, 100% by your Medicare supplement plan and by Medicare, 100% covered. After that 20 days, you're responsible for this co-insurance clause. And after 100 days, Medicare stops paying. That's where your supplement plan comes in and covers these co-insurance clauses. But if you are in the hospital, but you were considered an outpatient stay, Medicare doesn't cover these things. So that really kind of puts you at a lurch if you've got a challenge there. And when Medicare stops paying for nursing home, either because you're an outpatient or because you're no longer improving to the point to where you can recover fully, they stop paying whatsoever. So really, Medicare is not designed to pay for long-term care. It is designed just to get you your procedure taken care of, and then depending upon whether you're inpatient or outpatient, what type of short coverage that you have for that. So that presents us with some gaps, even with a supplement policy. And we're on this call today because of the WEA MedPlus situation and talking about what you need to do. But I wouldn't be doing my due diligence if I didn't tell you about what is not covered by Medicare. Okay. So your supplement's going to cover a lot of those other things that are no longer covered by Part A and Part B. Your supplement covers that. MJ can help you out in that regards. What we find is that about 60% of the cost related to cancer, a heart attack, or stroke are not covered by Medicare. We're talking transportation, comfort items, some recovery items, things like that. Medical transport. Medicare usually has a set schedule or a fee plan that they will pay for any type of ambulance service. After that, you're responsible for the remaining 80% of that coverage. Then sometimes Medicare will go back and look and say, you could have driven yourself, or you could have had Uber come pick you up, or a friend drive you in. We're not going to pay for anything. So you could be on the hook for that. And as I mentioned, elder care, Medicare nor private medical insurance is designed to pay any type of long-term care situation, at-home care, things of that nature. And there's not life insurance. It's a component of Medicare whatsoever in there. But the good news, and I want you to grab your QR code, grab your phone, open up your camera. Don't take a picture of it, but simply hover over that QR code, and you can get information about the Medicare supplement plan, about the Medicare solutions that can help you out in that regard. Because what MJ has done and what WREA has done on your behalf to guarantee acceptance is huge, regardless of your medical condition. Save some money, hopefully, put that towards, groceries, fight inflation, cover some of those gaps that you don't have covered through Medicare. So we'll open up for questions in just a moment. Want to remind you, we've got a very busy schedule tomorrow. Tomorrow morning at 10:30, we've got long-term care 201. I'd highly encourage you to get on that call. If you were on our 101 conversation, we kind of broke down what long-term care is. We're going to talk about it in 201 and address some of those issues of what are some alternatives? What do I do if I can't qualify for long-term care? Or what happens if I've got a long-term care plan and it just doesn't look like it's going to pay what I think it's going to pay? We had a great email this morning that came to Diane that she forwarded on to us from someone that took out a long-term care plan, probably through school, through a different corporation. And they're come to find out now it doesn't pay what they thought it was going to pay. We're going to talk all about those things. And then as we go in through October, talking about cancer, Medicare, protecting your nest egg, all the way up to the holidays, talking about all the fun stuff. So encourage you to get on the website and find out what's out there. Tell your friends about these webinars. This is a great way to pass along the benefits of being a WREA member. Hopefully get some of your friends to become a WREA member as well. So I'm going to open it up to questions here. MJ, is there anything that I missed in our conversation that you want to mention to folks? What would it look like if they use their phone and use that QR code, or they emailed me their information? What does that look like when you or your team contact them back?
Great question. So first and foremost, when they would use that, it would open it up to a form that they would fill out. We would then contact them. If for some reason you're not there, we'll leave a voicemail with the number to reach us back at. We would then understand from you what your plan includes. So some of the WPS MedPlus plans are just medical. Some of them are medical with vision. Some of them are medical, vision, and silver sneakers. Some of them are medical and silver sneakers. Again, everyone's plan is a little different with WEA Plus. So we would understand what you have. If you have a plan that has all three of those components, we would give you what that rating would be for a Plan F, which is still available in the state of Wisconsin for anybody that is over 65 years of age as of January 1st of 2020. Okay, I'm going to state that again. Plan F is still available in Wisconsin for individuals that are over 65 or turned 65 prior to January 1st of 2020. After that time frame, Plan F was no longer available to anybody turning 65 after January 1st of 2020. So I just want to make sure that that's very, very clear, because I think there was a question on that. The other thing is if somebody has vision, we will go and give you the information that we have for vision. What we have found is when we've done the plans with the vision, and even added in, if they wanted to do the healthy and fit, which is similar to silver sneakers, that rate was still lower than what they were paying with WPS. What we have found, and even Cigna has said this themselves, and other carriers have said this, is the silver sneakers is great if somebody's using it. Many times individuals are not using it, but John said it earlier, they're paying for it regardless. Okay. The question is coming up about escrow money. Will that be used for the Cigna plan? That is something that you'll need to work through with the school to find out if they will go ahead and if they will make that payment on your behalf. It is not something that is set up where they will automatically be able to, they can make that payment, but it's not something where Cigna is going to bill them. They would send that bill to you. So if you would take that bill to them and then they would reimburse, or they would make that payment directly to Cigna, that is fine. And so Cigna does have, again, the Plan F, because this person is being very persistent and I appreciate persistency. In with the state of Wisconsin, Plan F is equivalent to the base plan, like I said earlier, and 5 riders. Plan G, base plan, and 4 riders. So I want to clarify that one more time, and hopefully that is taking care of that. Through the escrow money through the teacher's retirement, that is something that you'll have to check with whoever handles that teacher's retirement, because we don't handle that program. So I'm not going to be able to give you an answer on whether or not that's something that they would do. We've had a couple of people that have basically worked with whoever they're getting those funds from, and they've been fine. Other people have not. So that's, again, it's not something I can give an answer that is a blanket statement, because we don't manage that program for you.
Great. If you've got more questions, drop them in the chat, Q&A. That's what we're here for, to answer those questions for you. Again, I encourage you, use your smartphone, hover over that QR code, and a little form will pop up. you can simply just select Medicare Solutions. MJ and her team will take care of you. If you're joining us on your tablet or your smartphone, you can't use the QR code, you can always email me, john.green@amba.info. It's JON.green@amba.info. Or I think MJ also put, did you put your email?
No, I
in-
can do that
Yeah,
really
put your
quick.
email in the chat. That way you can contact MJ as well. So don't let this time period scare you. That's what MJ and her team are there for, to walk you through this individually. She and her team have had, like I said, hundreds of conversations. So your situation is probably not unique, but it's important to you. And that's the importance of having this conversation so that you've got peace of mind. Even if you decide the Cigna plan is not for me, I'm going to go somewhere else because somebody at church told me this is the route to go. You've got peace of mind knowing you've looked at every option that's out there. You know what you have available to you. You know what WREA has endorsed and gone to bat for you on behalf of in regards to that. So again, encourage you, use that QR code, email MJ or myself. We'll be glad to get back with you and take care of you. And if you've got other questions, feel free to drop them into chat. We'll be glad to answer those for you. I'm going to stop recording at this time. And